I like to think about it's a balance, right? And the community has been so incredibly generous, not just with treasure, but also with time and talent, that they've supported the work that we're doing around our providing care for patients and teaching our students and doing research. And so it's time for us to give back. And so what does that look like? Well, that can look like, recruiting people into our community that will join, our WMed team, and then they'll be living in the community. It will be taking the really important work, I'd say the really important commitment that Kalamazoo and Southwest Michigan has had around building its populations and ensuring that we have access for all to health care. Also, this whole bigger idea of what we call health equity, so really breaking down the barriers of structural racism and other isms that have kept people from being able to get everything that they need, and by showing people that we can do it here means that they could do it there. So we want to be inspirational outside of Southwest Michigan. One is actually on my wall, as you can see, and it's creating the workforce that reflects and understands the people we serve. So a significant component of the gift has really been designed for us as an organization to diversify, create equity within our own ranks, create an inclusive environment, and that will help us, that we hope that will translate into creating health justice and health equity, okay? So in order to get that done, that means that we need to create that environment to get students in the door that really reflect all these different voices. And so we know that it's very important for us to think about diversifying our racial makeup, for example, of medical schools, okay? We also know that within the LGBTQ community, and the transgender community, we need to do a better job as a medical school to be able to invite people in. There are individuals who are of a variety of different socioeconomic backgrounds before they enter medical school that have a thought and a voice that could really help us inform what it looks like to provide care for others. There's geographic diversity. So there's a whole bunch of different ways that we can look at this. And we really need to touch on all of those different areas, because those are all the people that we serve, and ultimately are really should be held accountable for the kinds of health care that they receive.